which we will start our final session. We're just really excited to have you all rejoin us for the end of the day. I hope that we kicked you off in the way that I hope really inspired some conversations throughout the day around the equity issues. I hope you really got a lot out of the breakout sessions, and are excited to go back and connect with people outside of this and keep the work going. To help us keep doing that, we're going to hear now from our federal partners. So this is really our opportunity to hear about some of the federal initiatives and perspectives that are of vital importance to the work that we do, and to the direction going forward. So we are very excited to have Lily Griego. She is the Director of Region 8 for the U.S. Department of Health and Human Services. I'm not used to saying the entire title because I come from DC, which is by its very definition an acronym. So I only speak in acronyms. I'm doing much better at this. So she's going to share with you all some of the perspectives that are most important from Colorado, and we'll then go ahead and take some questions and continue the dialogue. So Lily, I'll turn it over to you.
Thank you, Kathleen. Joey, are we good? Fantastic. Good afternoon. Buenas tardes. Okay, y'all had the same energy this morning, and it is absolutely unacceptable to me. Good afternoon, everyone. We've reached the end of our journey with state reform. I almost said State Farm. Okay, sorry. Yeah, no State Farm. Thanks. Let me begin by saying a few things. I want to do two things that were not on my planned schedule here. First of all, I talk really fast, and we use government speak when we don't mean to. So when I say an acronym that you do not know, I want somebody in the audience to go, oh. So give me a practice session. Oh. Okay, so if I hear that, I'll stop and tell you what the acronym means. And if I don't know, then we're going to have to look it up. Let's begin with a moment of gratitude. I want to say thank you for three things. Number one, we're in this space together, we're talking, we're having dialogue, some of it really helpful. Some of you are walking away today with business cards, you're walking away with ideas, you're walking away frustrated, which is also how we get really good ideas, and you're networking. So this is fantastic. So there's a moment of gratitude to the state of reform. Let's say a moment of gratitude that we are experiencing global unrest. We are seeing violence on the TV and death and harm to other humans. It is damaging to ourselves as we see that, as we read it, as we look at it in social media, in the news, and then we are expected to show up for ourselves, for each other, for our coworkers, and for our families as we go throughout the day. I am grateful that you are here. I am grateful that you have showed up, and yet you're recognizing that this is important work at a moment when our country is embroiled in some really tense and unsettling times. So I'm grateful for that. I'm also grateful for the opportunity to be with you today and talk a little bit about what government does. I've been in government much longer than I ever intended to be, and I see a myriad of reactions when I say what I do. I never thought that I'd be standing up here this long into it with gray hair talking about government and how amazing it is. And one of my team members who's not here with us today often says, "Did you hear yourself? You said we're the government and we're here to help." And I'm like, but we are. So that's just a little bit of gratitude for me. I hope that you take a moment on your way home today to find a couple moments of gratitude for yourself throughout the day, and think big and think close to your heart, so whatever that means to you. Second thing on my list that I wasn't intending to do, let me share with you some of the words I heard today. Passion, equity, inequity, justice, policy, funding, community need, funding, social determinants of health, access, housing, funding, stigma, greatest need, workforce, funding, violence, gaps, education, pay, funding, cultural competency, cultural validation. I'm looking for a specific person. And I know that I stand between a lot of folks either going to other meetings or going home, so that person's not in the room. Pathways, pipelines, Language access, fix the workplace, not the worker. Who said that on a panel? Are you in here? Okay. Choice, in reference to reproductive justice. Proud of our work. Colorado has not put their blinders on. Hate crimes, my daughter. Funding, shaky bridge, opportunity, rural, disability, heads in beds. Are you in the room? I heard heads in beds on one of the panels. Exacerbated, funding, rules and regulations, stackable credentials, child care, grow our own, and funding. Let's move into the presentation. Why is it important that we reflect on what we've heard from each other today? Because what I hear in most places where I go is that we need more funding. We are short on funding. And then what I also hear outside of work are a lot of conversations about big government and little government. And I want you to think about the concept of, I'm a non-political person as a political appointee talking to you about what the government does, and it matters who shows up. It matters who our representation is. So let me take a moment and talk a little bit about representation. In front of you, you're gonna see United States Secretary Javier Becerra. Why am I gonna call this out? Because representation matters. He is the first Latino to ever be the secretary of this agency, Health and Human Services. Not the first secretary that is Latino or Hispanic, but the first one of Health and Human Services. You'll also see on there Deputy Andrea Palm. She has been with HHS under previous administrations. She brings a demonstrated leadership to our work and our portfolio, and that's why representation matters. Experience, different lenses, whether it's access or justice or equity, or a really, really broad focus on what is healthcare, or an MD or a JD. All of those things come to the table and have us, empower us to have stronger deliverables for you. I'm not going to spend a lot of time talking about me. What I will tell you is, as we get to the Q&A, I care about this work, I'm passionate about this work, and I'm passion-led, but I understand that people are data-driven. Passion-led, data-driven, those two things matter a lot in our work. You can see here the states that we serve. I will call out, how many of you in the room know that we do government-to-government work with the sovereign tribal nations? Show of hands real quick. Okay. I don't think that was about half, but it was pretty darn close. So we can talk about that as we move on. How many of you traveled to Colorado outside of Colorado today? Show of hands. Okay, great. So we just have, the majority of the room is Colorado. Those of you who are traveling or state of reform already knows this. HHS can be accessed across the country. Those are pictures of my colleagues. We are looking for a regional director in Region 6 and 10, by the way, but we do have really great representation in those two districts in the meantime. We have been very busy and hardcore focused on the priorities you see in front of you. These were given to the secretary from President Joe Biden. And the president said, we are going to center our work on equity. Do you remember hearing that this morning at the opening session? She said, I think when Kathleen asked her something about what do you want folks to do today, she said, I want you to center equity in your thoughts of what you're doing today. We center equity at everything we do, to include the secretary having a health equity plan for our entire agency. And so that is something that we are prioritizing. I'm going to keep moving. I'm not totally into reading slides for you or with you. What I can say, by the way, is that this slide deck is available to any of you with hyperlinks that are already embedded in it. I have some flyers right here with my colleague Joseph Toth, and he's waving. If you see these flyers right here, shoot me a quick email. Our contact information is in there, and we can send this to you. Let me spend a moment here, and then we're going to kind of move through the slide deck. What are deliverables from the Biden-Harris administration? ARPA funding. How many times did y'all hear today? I heard COVID funding. Somebody called it that. It's all the different names. How many of you have worked or touched or written a grant for ARPA funding? It empowered you to do work at a critical juncture. It empowered a lot of people to hire other people to continue the work of your mission or your organization. And we are also hearing at this moment what's going to happen when that funding is done. And that is a critical conversation that we highly encourage you to join us in. You might have also heard the word Bidenomics. What is Bidenomics? We are focused on lowering prescription drug prices, cracking down on junk health insurance plans, preventing surprise medical billing, and protecting consumers from unfair medical debt. These are really critical junctures to the healthcare sector. Let me talk about the Inflation Reduction Act and some of the key health provisions. And by the way, have you all heard of the Inflation Reduction Act and assumed that it has to do with the environment only, or that you thought maybe I've only heard about it as it relates to the environment, but you didn't know that it totally impacts our healthcare system? I am one of those that is going out in community, and Joseph and I are out in community sharing this with folks, especially folks who are on Medicare Part D, or are approaching that age, or those who serve that industry or that community. And Jayla, I'm thinking of you. We called you up and said, hey, join us in this endeavor. Why? Because it allows Medicare to negotiate lower drug prices, caps copays for insulin, prescriptions and Medicare beneficiaries at $35 a month, offers improved financial protections for out-of-pocket drug costs in Medicare Part D, and you're going to see extended savings through the Affordable Care Act, healthcare marketplaces that are bringing 13 million people an average of $800 a year in savings. Let me come back to the Inflation Reduction Act in just a minute. I want to also talk about the American Rescue Plan. It did so much that we could spend hours talking about the benefits of the American Rescue Plan, but let me just point out a couple things. A record-breaking 14.5 million Americans signed up for health care through open enrollment. We have a historic insured rate right now. Historic insured rate. Why does that matter? I'm going to talk to you a few minutes about Medicaid unwinding or Medicaid renewals or Medicaid redetermination. You're going to recognize that language, and we've all kind of heard different things as we've progressed through the last few months at the end of the public health emergency. But let me come to that in a moment. Back to the American Rescue Plan. To address mental health and substance abuse care, we invested $15 million via CMS, or Center for Medicaid and Medicare Services. I didn't get any oohs, so I'm glad that y'all know what CMS is. And that was really intended to focus on mobile crisis intervention services. We also addressed maternal health. We encouraged states to provide 12 months postpartum coverage to pregnant folks who are enrolled in Medicaid and or CHIP. I do not see Senator Fields in here. Senator Fields, are you still here? I wanted to do a shout out to Senator Fields and to the state of Colorado for taking advantage of that and extending postpartum care for a full 12 months. And we're seeing in the maternal health crisis that we're going to talk about how valuable that is to Coloradans and to Americans across the country. Lastly, two bills that I'm not going to spend a lot of time on today. The bipartisan infrastructure law, by its name, does not sound like it's related to health care. Immediately, I think of planes, trains, automobiles, infrastructure, bridges, things of this nature. And we've heard Secretary Buttigieg talking about these things. As it relates to our work, we have secured water and high-speed internet services for tribal communities, cybersecurity for tribal communities. I would love to spend another hour talking about cybersecurity and the threat of ransomware with y'all. That's another thing that we focus on, but we're not going to do that today. Key health provisions of the Bipartisan Safer Communities Act are really directed toward gun violence, and let me just share one data point with you. HHS, or the Health and Human Services, along with the Department of Ed, have already delivered more than $1.5 billion to states and communities to make our schools safer, improve access to mental health services, and help young people deal with the trauma and grief resulting from gun violence. With this funding, schools are projected to hire an additional 14,000 mental health professionals over the next 5 years. And as I say that out loud to you, I know that there are people in this room, I was going to say someone, but I know there's more than one person who says, good luck. Did you not hear, you said workforce? Did you not hear us talking about workforce today? Yes, we want to talk about workforce, but we are really grateful that President Biden, through the leadership of Secretary Becerra and Secretary Cardona over at the Department of Ed, have intentionally carved out a plan and are backing that up with money through funding. Let me take a moment to talk about strengthening behavioral health. And by the way, we have a huge portfolio of policy work that we touch every single day. So that's why I'm kind of going through these and touching on them lightly. I want to get to some questions with you all. So I hope that you bear with me while I kind of speed through these. At the first State of the Union, Joe Biden said, there's a mental health crisis in this country. He called it out, he called it by its name, and he said we're going to address this. So the deliverables via HHS include the launch of 988. In its first year, 988 received 5 million calls, texts, and chats. 1 million of those were our veterans, those who've made the greatest sacrifice for this country. When you call 988, you can press 2 for ayuda. It's our Spanish-speaking option. When you press 1, you get someone on the line to help you text, call, chat for veterans. When you press 3, you get someone who will speak with you, young adults, LGBTQIA+. So we are intentionally focused on, number 1, creating access, and number 2, putting this into community. If you're a Wyomingite and you call for call 988, the intention is that you get a Wyomingite, and we've heard that today, cultural competency, cultural validation. Rural, we've heard the word rural today a lot. What about other areas of this country that are unique to themselves? The intention is to get help to you that feels and sounds like you. The other thing that we did was we launched the Roadmap to Behavioral Health Integration, and again, this is a hyperlink. We'll be happy to talk about this with you. And then naloxone. How many of you all know the news that now naloxone will be more accessible? I see heads nodding. Last year, we took a trip up to a city here in Colorado in the Mountain Corridor. A small practice, a nonprofit, shared with us a story about a football player. Never did drugs in his life. He went onto social media. He had pain, and his parents had no health insurance. And he thought, I'm going to just fix this problem myself. So he asked somebody for some pain meds. He's not here anymore. His parents have to deal with the loss of that child. We are doing things that have deliverables to address the issues that our country is facing with fentanyl and with opioid addiction and or substance use disorder. And naloxone is one of those deliverables to make sure that we're making it accessible. And I hear from the law enforcement community and the first responders, give us more. So we hear those pleas, and by the way, I should say as a footnote to that, when we meet with folks, the information that we take in, and I say we, I talk about the team, we send this to Secretary Becerra every single week. So that's the power of that relationship. I will say that ASPE, one of our agencies, I don't know. Assistant Secretary for Preparedness and Emergency Response, Planning and Evaluation. Thank you. Look at Kathleen here from Portland, AKA DC. Anyway, so ASPE has a report, and they have breakdowns by state. So in our hyperlink, if we send this to you, you can see the fact sheet for every single state as it relates to that data. Preparedness, I'm not going to spend a lot of time on this. Oh, let me stop for 1 second. I have mentioned funding multiple times. This is just an example. How many of you know the acronym SAMHSA? How many of you know the acronym HRSA? Those are the 2 largest grant issuing agencies within Health and Human Services, and this is one of their data points for funding out into community. And again, we're not going to deep dive on that today. We've talked about the Inflation Reduction Act. I think actually that's where we're headed. I read that to you. Disregard. I'm going to keep moving. Preparedness. I was talking about ASPE. Let me just mention 2 things to you. Asper Tracy. That is not my neighbor, Asper Tracy. It's a new acronym, and I looked it up before I came up here because they are actually working with us, and we just had them join us for Pride Month on a call for Region 8, and they shared some information. It's a new agency within HHS. Tracy stands for Technical Resources Assistance Center Information Exchange, and again, we can send this to you. ARPA-H stands for Advanced Research Projects, Agency for Health. Now, let me tell you why I don't know those. Again, Secretary Becerra has said, this is what the communities are telling me they need. We're going to meet that need. So we have new operating agencies and staff agencies within the Health and Human Services Department that are addressing these needs in a very specific way. So the folks from ARPA-H are coming to Colorado in November. If you're interested in this, what we understand is they work with the tech community and the startup community to address health needs, and they have funding behind them. So if you're interested in learning more about how the tech industry meets with the health industry and comes together to solve problems, that's what that's going to be about. And again, we'd be happy to meet with you about that. Maternal health is one of my very personal policy issues that we have focused on in 2023, along with rural health. Why? Because a lot of people don't know where we are with this. If I go talk to my niece who just had 2 beautiful daughters, and I say, did you know that this country is in a maternal health crisis? Do you know that we are not keeping up with the standards of most first world nations? She says, I had no idea, but I've seen a lot of my girlfriends who have had a miscarriage or have had mental health issues in that first 12 months after having the baby. And I didn't realize that this was a national issue. I thought we were alone. So I could spend a lot of time talking with you about maternal health, but we did deliver the maternal health blueprint. You may have heard Vice President Kamala Harris speaking about this as she is traveling the country and working on this. And through HHS, you'll see the hyperlink there, we have created not only the maternal health hotline, very similar to 988, is that you call and you get someone who will understand and can speak with you to the experience that you may be experiencing and deliver services in a moment of crisis. And very recently, as of last month, as part of the HHS Maternal Health Day of Action, the Biden-Harris administration announced more than $103 million in funding and launched new initiatives to address the maternal health crisis. I have in front of me, from that announcement, 3 pages printed to go over with you. And because of the use of time, I'm not going to do that. But it's talking about, let me just read a few things to you here. Better trained providers, no more surprise bills, substance use services, improved maternal health data, a diverse maternal care workforce, better access for doulas, better access for midwives, expanded social services, listen to this, stronger partnerships between the departments of housing, which, by the way, for us is HUD, or Housing and Urban Development, agriculture. Can I get a quick show of hands? How many of you in here know that USDA has lots of funding that intersects with HHS? Okay, fantastic. We have more work to do to get every hand raised. Call me if you want to know about that funding, because it especially is helpful in rural communities. I spread that word. If there's money, we want to get it out the door. But this is focused on housing, food, child care, income access, income assistance, and more things. Also, and I think we've already covered this, extending postpartum coverage, and announcing the new birthing-friendly hospital initiative via CMS. So let me just share a quick video. Actually, CDC is another acronym that you probably are quite familiar with. I don't like the phrase, as you know, so if you don't know, let me share this with you. CDC did something called the Hear Her campaign. Why? Because data demonstrated that when women of color went to their doctors and said, I am feeling pain, and this is not limited to women, by the way, I am feeling this pain. Their pain was not recognized, and just as recently as 2 years ago when I met with a black doctor, she said, do you know that they still train pediatricians with white babies and white books, and books that just describe instances of jaundice as it relates to white babies? It disempowered the doctors to go into communities of color to be able to recognize jaundice with the African American community. I thought she was telling me a story of 20 years ago. It was just this last couple of years. So I'll turn it over to my good friend to play this video.
He's the one who noticed his mom's face was swollen. They're the ones she confided in about her change in vision and headache that wouldn't go away. He's the one who really listened when she said that something just didn't feel right. When she had chest pains a few weeks after delivery, she's the one who insisted on admitting her to the hospital. Too many women die from pregnancy-related complications each year in the U.S. Death can occur during and up to a year after pregnancy. It doesn't have to be that way. Most deaths are preventable. Know the warning signs, hear her concerns. You could help save her life. Learn more at cdc.gov/hearher.
Thank you, Joey. Okay, I think 3 more points and we're done. Well, I'm done here and I'm going to join Kathleen, so don't leave. Reproductive health, reproductiverights.gov. Have you visited this website? Show of hands real quick, like. Not one person in this room has visited this website. It's not a bad thing, it's an informative thing. So did you all know that President Biden has 2 executive orders as it relates to the Dobbs decision, and through HHS, through the leadership of Secretary Javier Becerra, said we are going to do everything we can to ensure a woman's right to choice. We are working on a myriad of issues as it relates to abortion care and abortion access. You may be in this room and say, I love that, thank you for saying that, say it more. You may be in this room and you may say, I disagree with that completely in my beliefs or my faith or my value system. And let me share a data point with you that I did not know until recently because of this conversation, and I come from a very religious family, by the way. If you go into a community and a doctor does not know how to perform an abortion, and I think of rural, small town communities. Region 8 is highly rural, by the way, highly frontier. And the doctor there cannot perform an abortion. Your maternal health for the community, you can draw a line from the hospital or the care center out and create a circle around that community where the maternal health will be in decline overall. So it's important to underscore our work in this space and that this is a civil rights issue that we are hardcore focused on. If you have more questions about this, I would be happy to spend time with you. And we do look at it from the lens of a civil right, and we do look at it through the Office for Civil Rights, which is another agency within HHS. I'm very proud to work with those folks and be alongside them. So if you're interested in that, please let me know. And I don't think we're going to play it in the interest of time, but this link is in our video if you were interested to share it out. I understand there could be repercussions. We are still hardcore focused on making sure that folks receive an updated COVID vaccine. I want to say thanks to, I think I might mess up his name, Kelsey Travis, is that right? Did I say that right? Wrong? I don't know. Yes? So I guess he was called a name and he responded, a football player. Thank you, Travis Kelsey. She's like, excuse me, Kansas City Chiefs. And I'm like, hashtag Broncos. Okay. So, oh, look, now you're awake. The reason I'm calling him out is that he did a fantastic job in such a controversial subject, in such a divisive subject where we have seen a distrust of health professionals increase over the last 3 years. And he said, I did this to protect my community, my family, and I believe he said his teammates. It was spot on perfect. This video demonstrates that we just had a release of information that says that pregnant women are able to get the vaccine, and we encourage that messaging as well. And I'm going to end with an ask, but I think we can achieve it through our Q&A on Medicaid renewals. And so I just want to say thank you again for being with us, and thanks for staying with us till the very end. I know that it's been a doozy of a day to stay together, but I thought it was fantastic, so thank you.
Wonderful. Thank you, Lily. Well, I am going to open it up for questions, and we can get to the redebts or redeterminations as an issue as well. So any questions from the audience or things you want more information about? Funding opportunities you want to hear more about?
It's a quiet group.
It's okay. By this point, I'm hoping I've wrung them out, so that's not a bad thing. All right. Well, I do want to talk about 2 things. If it's okay, I'll take that prerogative. The first was actually, I wanted to delve a little bit into something that came up in a few places, and you mentioned it briefly, but Medicare.
Okay.
So Medicare is not in the state control, but has a lot of implications at the state level. You talked about Part D for prescription drug costs, and price controls have been something we've been talking about today. Anything else on the Medicare agenda you think would be worth mentioning here?
Well, there's a lot of work being done. So thank you, Kathleen, for the question. And how many in the room, I just keep getting a pulse for the room, how many of y'all work on Medicare? Okay, and Jayla and I just chatted. There are concerns right now in the community. let me take a really big step backward from the conversation before we even talk about this. Do I have revelatory news? No, except for the Inflation Reduction Act, which is what we're hardcore focused on. And as President Biden says, we have to get the job done. So we have a lot of work to do. The Inflation Reduction Act started this year and will continue for each year with progression to save seniors out-of-pocket expenses. But let me, again, as I mentioned, take a step backward. As we travel the region, I'm spending a lot of time in Montana and Utah and Colorado. I've been up to South Dakota and North Dakota as well, but we've been spending a little bit more time in those communities that I just mentioned. When you retire, it's supposed to be the American dream. It's supposed to be that you worked hard all your life, and you got to a place where you can now stay at home and you've earned enough that you're gonna be safe and secure and enjoy your retirement. I shared this story with somebody else that I heard an encore career. They said, we're giving it a nice name because seniors are having to go back into the workplace. And I said, don't give it a nice name. Please don't give it a nice name. Please don't talk about this as it's a nice thing, because it is heartbreaking for me to think that people on fixed income, limited access to health care or health insurance, are forced back into the workplace to hang on to a roof over their head or a car or that's not even talking about heat and electricity and water. And we do, by the way, as I mentioned, those two things. We have LIHEAP through HHS, you may not know that. But what we're seeing is that American dream is fragile. And so I take this work personally with two parents, both in their mid to late 70s, and understand the fragility of this situation as we see, if my parent had to come live with me, I become a caregiver. And now what happens? The state of Colorado, and I don't work there, so I can't speak as a subject matter expert, they do have a new law where I could go get a license and receive Medicaid reimbursement, if I'm not mistaken, as a care provider, caregiver, for a family member. That's not national. And this really puts a strain on American families. And so I really segued away from your question. If you have something specific, we can go to it. But I think that this is a conversation that warrants a lot of us spending time. Yes, the conversation about youth and mental health is extremely vital. Yes, the conversation about workforce and replenishing the workforce. We heard in one of our panels the deficits that we're facing. We heard about the baby boomer and the greatest generation retiring out and the deficits that's gonna create. Those things that matter. Spend some time with a senior audience and ask them what is impacting them and how they're able to get through weeks, months, and years in a financial situation with a fixed income. And it's a real eye-opener, by the way, and it might take you a minute to process it, but it's good for us to have that knowledge of all of the multiple generations of what they're dealing with.
Yeah, and I didn't have anything specific, so that's really helpful. I just think it's a context that when we speak from a state perspective, we sometimes forget some of those other programs and efforts and issues that have a lot of impact on those populations. So I just wanted to make sure we covered that a little bit.
I thought of one more thing. My apologies. CMS, Centers for Medicaid and Medicare Services, they actually started yesterday. The administrator is holding national calls, and I think they're going through November. Again, we can get this information to you, to talk about the 10 prescription drugs that are in negotiation. If you work in this industry and this is of importance to you, let us get this information to you. Join these calls because we are looking at the prescriptions that cost the most, and we've entered into those negotiations. She's talking to folks about the very granular level details of the timeline, which drugs, what do they treat, and I think they're very informative, and they're about an hour middle of the day. And again, this is part of a series. So if you're interested in that, we can get that information to you.
Tremendous, wonderful. Yes, please. Oh, we got a mic coming to you in just a second Heather's got you.
I'm just wondering if that includes the Alzheimer's drugs, because they were considering it and then it was off the table, then it's back on the table.
I don't think she included it yesterday, but we can certainly find out. Does everybody in the room know what Jayla's talking about? So can I just share with you, I was super excited that the Alzheimer's Association, I have a good working relationship with them from previous work. They sent me a quick email and they said, we're gonna come protest your office, just so you know. And some of my colleagues said, oh my gosh, did you see the email they're gonna protest? I said, isn't it lovely? Let's invite them inside. And so, yes, we did invite them inside. Doing the work that I do, this is dialogue. And this is what I said as we came together. I don't care if it's comfortable or uncomfortable, dialogue gets us to solutions. And so the awareness that we create and can build on when we have these conversations is really important. So the Alzheimer's Association was hardcore focused on access to medications to treat Alzheimer's. And we can certainly look into that. I don't think it was, but I'm not 100% sure.
Thank you. Okay. Well, I think one of the words that you listed, Lily, was partners. And of course, the federal agencies are our partners in this work that we all do at the state level, and that you all do in the broader healthcare marketplace as well. I want to thank you for your time. I want to thank all of you for joining us today, for staying with us through this session and throughout the day, and for your participation. I've been able to join a lot of the breakout sessions and just really appreciate the questions, the engagement, and the attention that you all have given to these issues today. I hope you will continue the conversation. And again, thank you for joining us. Thank you to our sponsors for providing this opportunity for us. And we hope to see you at the 2024 Colorado State of Reform Conference. And with that, I hope you all have a good evening. Take care. Thank you. Safe travel.